Okay, so my APL presentation is on sedation in pediatric patients and assessment of pediatric knowledge, and I am Preston Bavona. The purpose of the paper was to evaluate the general knowledge of sedation tactic used by the pediatric dentist. Some of the main concerns that they were worried about is, do they feel safe and comfortable about the sedation process, and if not, why are they scared? One of the main things the paper is trying to say is you can do it and it is possible. And they did link fear and anxiety as interdependent for dentists that are worried about sedation process and the adverse effects that it might cause their patients. But one of the things that they try to say was they want to control the child's behavior as best as possible using behavior techniques, oral sedatives, inhaled nitrous oxide, or general anesthesia. And it has been proven that moderate sedation promotes positive behavior in follow-up visits. So what they were testing was there's a 13-part questionnaire asking just 126 local pediatric dentists about their knowledge of sedation, like how many years they've been practicing, what sex they were, where they worked, if they've taken a sedation course, etc., etc. The majority of the people tested had 5 to 10 years of work experience. What stood out to me was 94% of them were female, and 60% of them worked in a public and private workplace. So this is also kind of seems like a red flag. The majority of them have never taken a sedation course. As you can see, 78.8% of them have not. And another 2/3 of them did not use sedation at all because they did not feel safe. And for the ones that have frequently used sedation, the majority of them use it 4 or more times. I mean, as you can see at the bottom, it said 63% elected to not answer that, and I assume that's because they were the ones that did not use it because they did not feel safe. So the next table represented the drug. They were asked what drugs you use, the advantages or disadvantages of sedations, and what they think the risks of sedation are. And this got a bunch of mixed reviews between the preferred drugs of either midazolam or chloral hydrate, the advantages of sedation versus the disadvantages. The main advantage, they said, was the possibility of conditioning and getting the kids to, once they're sedated, they're more comfortable in the chair and they want to come back and not be sedated, but they won't not enjoy being in the dentist. And the disadvantages, the main ones they pointed out was the drug unpredictability and its adverse effects, so how the kid would potentially react. And one of the main risks of sedation that most of these pediatric dentists pointed out was the allergic reactions that could potentially come about because of the interaction between the kid and the drug. So the result, in my opinion, it was a lot of weak data because all it was a questionnaire and it only recorded percentages. There's no statistical test run and there's no baseline for the questionnaire, so they never had a control group or anything talk about this and that of what potentially should be the answers, I guess you could say. So they kind of just went out, asked these 126 people these questions, and that was it. So you never really had a baseline. What they discussed with these pediatric dentists was midazolam was key. It effectively modifies the behavior of children with mild to moderate anxiety. Another sedative, like I mentioned earlier, that they were using was chloral hydrate. However, the general trend of these dentists is moving away from its use due to its potential carcinogen from trichloroethylene, which, although it has not been tested on humans for this research, in pigs it causes chromosome changes. And with children, it has shown to cause deep sedation and potential upper airway constriction, so we know that's a big no-no. Amnesic and adverse effects of the drugs are being studied more because you want to reduce, the main thing is what we're trying to figure out is we want to reduce the memory of the dental procedure in the child. We want them to just go to sleep and just wake up and everything be done. And if they don't remember a thing, they can't have a bad experience. So another thing is improper technique is the top reason why dentists are fearful of sedation. And one of the main things this paper did point out was the adequate training and necessary equipment for not only the pediatric dentist doing the sedation, but his entire staff. It's important to have everybody on the same page. And just some of my conclusions, the results somewhat prove the hypothesis, and the conclusion does technically align with the results, although the data was really weak. Like you can see, authors do describe the pediatrics knowledge as reasonable about the topic, so they knew what was going on, they knew what the topic was about, but they're just fearful of using it, and they were trying. The main point of the paper was to get them to realize that it isn't that. You don't have to be fearful. And like I said, mentioned earlier, the weak data was due to the absence of a control group, no significant findings, and they never proposed another experiment or a follow-up questionnaire with these pediatric dentists. Maybe they could, asking them in about 6 to 12 months. Did they have they tried using sedation for the ones that haven't? And if the ones that did, do they feel more comfortable using it? So, if there aren't any other questions, that is it. Thank you for listening.